In my presentation, I will show data about other newer markers, such as inflammation markers or synaptic markers. These are still in the research field, so they're not implemented in routine clinical practice. But I think over time, we will probably get useful information by complementing what the standard core AD biomarkers give us. So one example is for predicting decline, then these other markers can help us to say whether the patient will progress faster or not. We know that the decline in a single patient can vary sometimes from patient to patient, so there's wide variability, and we still do not have good markers to predict the progression of the disease. And in this way, synaptic markers, I think, can be a good addition to the standard core AD biomarkers by adding this layer of information about progression in time and the speed of decline. I will show data about VAMP-2. So in this study, we investigated VAMP-2, which is a marker where we have developed an assay for together with a company, and we look at the levels in CSF in Down syndrome. And what we found is that this marker increases in cases with Alzheimer's disease associated with Down syndrome, which is a very common cause of cognitive decline in this population due to the genetic defect of the triplication of the APP gene. And what we found there was some degree of correlation between VAMP-2 levels and some of the cognitive tests, suggesting that it can capture some of the cognitive decline that occur in those patients when they develop Alzheimer's disease.